Welcome everybody on this 18 months progress report. Let me introduce my PhD topic about the management of postoperative complications after third molar removal. My name is Eszter Hardi, and my vision as a PhD student is to improve the life quality of patients undergoing oral surgeries, and my mission is to find the best solution that alleviates patients' complaints after third molar removal. To achieve this, these are my current specific goals. I am investigating the effect of perineural mix injection, the kinesiology tape, and different flap designs on postoperative complications after third molar removal. My first project is about the effect of perineural mix injection in reducing postoperative complications after third molar removal, which is a systematic review and a meta-analysis. Why is this topic important? Because impacted lower third molars is found in 90% of the general population, and about 85% of third molar will eventually need to be removed. And after this surgery, in the first 7 days, patients have trismus, swelling, and pain. So our question is, how can we reduce these symptoms? Well, Twin-mix anesthesia is a novel technique for mandibular anesthesia. What is Twin-mix? It contains local anesthetic solution and steroid. How it works. Addition of dexamethasone decreases leukotrienes and prostaglandins and increases the pH. And because of this, it decreases the pain, shortens onset, and prolongs the duration of anesthesia. So I compared a conventional anesthetic solution and the Twin-mix injection. My primary outcomes are the swelling and the trismus, and my secondary outcomes are the postoperative pain, the pain score on local anesthetic injection, the duration of soft tissue anesthesia, and the latency of anesthesia. I did a selection in the main 3 databases, and after that I had 8 eligible full text. Well, I would like to present the results of the first and third day, because these days are more significant. So my first 2 figures are investigating the effect of perineural mix injection in reducing postoperative facial swelling on the first and third day. The facial swelling is one of the most important outcomes because it largely determines the life quality after the surgery. In this case, the swelling is obtained by subtracting the postoperative condition from the preoperative condition to obtain the difference in millimeter. Here, the ideal situation would be 0 millimeter, which means there is no facial swelling. The swelling was measured on different face lines, what you can see on that picture, and based on this we made subgroups. The pool defect sizes are highlighted in red below the figures, and the average facial swelling is around 20 millimeter. So on these 2 figures, the facial swelling was reduced by 20 and 25%. So we can say that these days are clinically relevant. The next 2 figures are investigating the effect of Twin-mix injection in reducing postoperative trismus on the first and third day. The trismus is also important because it largely determines the life quality after the surgery, and if there is a mouth opening limitation, then the eating, the speaking becomes difficult, and the maximum mouth opening becomes painful due to the muscle tense. So, in this case, the degree of trismus is obtained by subtracting the postoperative maximum mouth opening from the preoperative maximum mouth opening to obtain the difference in millimeter. Here you can see that on this 2 figure, the reduction is significant, but clinically it's not relevant. The next 2 figures are investigating the Twin-mix injection the effect of Twin-mix injection in reducing postoperative pain on the first and third day. The postoperative pain was measured on this 10 points visual analog scale, and you can see that here the heterogeneities are quite high, and the explanation for this can be that the pain is a subjective feeling. We can say that these numbers are clinically relevant. The strength of this meta-analysis is that only RCTs were included and the analyses were performed at multiple time points. And the limitation of this meta-analysis is that not the same references was used in case of swelling. In conclusion, the TWIMIX significantly reduces the patient's swelling, trismus, and pain in the first 3 days. And we can say that the TWIMIX injection is useful because no additional injection is needed and it contains low amount of steroid, so there is no complication and the cost is low. And the implication for research is that we should make more studies for better evidence and follow up on each day and use standardized measurement points, and we should include patients with similar patient's characteristics. After 2 rejections, my third choice is the Journal of Dental Research, and I submitted my paper in January. My second project is about the effect of kinesiology tape as an edging therapy in reducing postoperative complication in third molar removal, which is a randomized controlled trial. But the problem is the same. We would like to reduce the postoperative complication, and with this current treatment, the postoperative complications are still present. So our question is, how can we reduce these symptoms? Well, we always suggest the cryotherapy after the surgery because it produces vasoconstriction, controls bleeding, and decreases of tissue metabolism. In addition, a new technique appeared, which is the kinesiology tape treatment. How it works? It leads to the activation of Meharry receptors by causing pressure and improving blood and lymph circulation. So my aim is to assess whether pain, swelling, and trismus following surgical removal of the third molar can be reduced by kinesiology tape. So I can compare the kinesiology tape with different tensions and the placebo. My primary outcomes are the swelling and the trismus, and my secondary outcomes are the pain, the painkiller intake amount, the kinesiology tape discomfort, and the quality of life. The position of the wisdom tooth are in class 2, level B, according to the Gregory classification. So my hypothesis is that kinesiology taping with 40% tension is more effective than other tension and placebo in reducing pain, swelling, and trismus after this surgery. So now I am working on the protocol drafting, and after we got the sample size, which is 82 patients per group. My third project is about the effect of different flap designs on patients' morbidity after lower wisdom tooth removal, which will be a systematic review and a network meta-analysis. The surgical removal involves the manipulation of both soft and hard tissue, and it is usually associated with a number of complications, such as pain, trismus, and swelling, wound dehiscence, alveolar osteitis, periodontal diseases. And we can say that the incision and the flap designs can be an influencing factor. So my aim is to assess which are the best type of flaps that can be used to reduce postoperative complications after the third molar removal. Here you can see that I will compare these flaps, and my primary outcome will be the swelling, the pain, and the trismus, and my secondary outcome will be the alveolar osteitis, the wound dehiscence, the periodontal condition, and the operation time. So after the full text selection, I have 35 articles. And my plan is to finish my second and my third project in this summer. And I'd like to thank you for your attention with a quote, "A goal without a plan is only a dream." Thank you.
Thank you for your presentation. And before I just pass the microphone to others, I want to ask you that can you tell us, just in one sentence, that what was the primary reason of the rejection from these 2 journals? Because that's my benefit for everybody.
Well, my first journal was the Journal of Oro-Maxillofacial Surgery, and they said that this topic is not the best for, yes, the best So they rejected it.
So it's
but
out of,
they
out
said
of
that,
scope or
yes, but they said that it's a brilliant paper, but they have to reject it. And the second paper journal was the Journal of Dental Research, and well, they didn't reject it. They would like to transfer to the Halion, and the submission. So. For the waiting for the submission is 171 days, and I wouldn't like to wait it.
Okay, thank you.
Thank you for your presentation. I have a very simple question. That do you use in your practice kinesiotapes, or do you have any collaboration with kinesiologists after the procedures?
Mm-hmm.
So
well. I didn't use it, but I would like to use it. And I think in Hungary nobody uses it, but in India or East they sometimes use it. So I think we should include it in the everyday practice.
Congrats to very nice results. I would like to ask regarding the first topic, if you have some outcomes regarding the safety, if there was something in literature regarding the safety of the procedure of twin mix and adding the glucocorticoids to the anesthesia.
Yes, how I mentioned, it's just 4 milligram or 8 milligrams, so it's a really low amount. So the literature said that there is no complication. Of course, the patient should be healthy and something like that. So if it's contraindicated, the steroid, to give steroid, of course, you should avoid it.
This was also part of the exclusion criteria?
Yes, of course, yes. Patients were healthy and they were in the ASA 1 category.
Thank you.
Thank you for the presentation. I'm actually also interested in your second study. I found it quite, it made me curious. So I don't know how far you've gotten with planning the protocol, but how are you planning the intervention? Will there be clear guidelines for how the tape should be placed? Who's going to be performing the intervention? Could you tell us more?
I didn't find a guideline about the application of kinesiology tape to the face. So I think I should use the previous articles where they described it, the precision. So.
And will there be one person who's performing the intervention, or will it be different?
One person, of course.
Okay, so you'll have a unified way of performing it?
Yes, one person, of course.
Great. Thank you.
Just one small comment as well. If I remember correctly, your plots were clearly statistically significant results. But you said, however, it's clinically not relevant.
Yes.
Could you elaborate more on that?
Yes, of course. In the literature, I found some numbers about it. So in case of swelling, the border number is 3 millimeter, and in case of trismus, it's 5 millimeter, and in case of postoperative pain is 0.57 millimeter point. Sorry.
All right, and I'm just curious now again, how do you measure the facial swelling? Like which technique or?
Well, in the articles, they measured the facial swelling on different face lines. So, for example, from the tragus, Callion line, and they measured this and they compared before the surgery and after surgery on the first day, third day, and seventh day.
All right, thank you so much.
Thank you. Can I have just one question regarding the third project? Is a clinical study, as far as I remember.
No, it will be a network meta-analysis.
It's a network meta-analysis, and there are so many articles. There was 8 or 10 different flap designs. So, are you sure that you will?
No, it's after the full text selection. I have 35 articles.
Yeah, but if you have 8 or 10 groups, subgroups, because of there were list of 8 or I don't know, I mean 10,
Yes.
10 different flap design. I was one. I'm not an oral surgeon, but I wondered that how
Yeah,
many
maybe I should
reduce.
yeah,
Because yeah, okay.
of course.
Thank you.
Or could I just reply to your comment? Because in the case of a network meta-analysis, it's usually best to include all of the interventions that are available. So just reducing because you're worried you won't find data isn't really
Yeah, I'm
suggested.
just wondered that this is again, I'm not a oral surgeon, but this is a tiny place in the mouth. So I can't believe it that this flap design is really
Exist.
different. No, it's really different, or they're really just tiny different. And then you will have low sample numbers, and you are using different flap design, which is almost the same. So that's why I'm.
So would you suggest then, in case,
Or maybe-
would you suggest grouping them
Maybe-
together?
yeah.
That,
But
that
I'm.
would be an option,
Yes.
or reporting in the paper that you didn't find data. That's also an important finding.
Yeah.